Hello and welcome to a series webinar called Research, Education and Advancement in Community Health, initiated by SHSRC, which will provide a platform to public health fraternity where we ex- expect participants with engaging presentation, insightful discussion, and an opportunity to learn and grow together for betterment of the community. Welcome back to the season 2. Today is our episode 3. Today we are delighted to have Dr. Hardik Solanki, team lead at Sresh Gujarat Initiative. So I would like to tell about Dr. Sir. He is he is a public health professional with MD in community medicine from the renowned institute PJ Medical College and brings over 12 years of experience in health system design and strengthening, and he has also worked in strategic role with the World Health Organization, contributing in significant to India's TB policy making and guideline. Dr. Solanki sir is an panel with an international TB consultant by WHO CRO, and he has presented his research work on global platform. So today's his topic is research priority in tuberculosis. Let's welcome Dr. Solanki sir and begin with today's session. And heartfelt thank you to all of participants for joining us and today's webinar. Over to you, sir. Thank you.
Thank you so much, Ajvi Ben, for introduction. I'm really glad for this opportunity provided by SHSRC and providing the excellent platform to discuss and articulate the recent advancements in the public health. So today's topic in this series is regarding the tuberculosis. And very specifically, we are going to discuss the research priority in tuberculosis. It is a very important topic, at the same time very much helpful for all of us when we are, as a student, need to do the certain amount of a research work as a part of our academic, as a part of our curriculum, as well as there is a ample amount of a career opportunity after doing MD or a MPH in our public health. So this particular topic will definitely be very helpful for all of you. Shrestha Gujarat, I am currently providing the support to the Shrestha Gujarat as a team lead, which is mentioned by Ajvi Ben. So what is this Shrestha? Just give you the brief background from where I am coming right now as a team lead. So Shrestha Gujarat, which is a World Bank project implemented in 2022. It is almost like a 500 million project leading by the Commissioner of Health. It has a 4 specific result area, which includes the 1 CPHC, 2nd adolescent girl, 3rd disease surveillance, and 4th quality of care. There are 11 disbursement linked indicator and 41 disbursement linked results are there. The entire project will be work on the P4R, that is performance to result framework. So this is a brief background of a Shrestha. Now let's get back to our core area about the research in a tuberculosis. Now this particular pyramid of a research, we know, okay, as an academician, as a student of a public health, we know this various research studies, whether it is a non-human trial, animal studies, in vitro studies, various observational studies, intervention studies, meta-analysis, and the systematic review. And it has been kind of put up in a specific hierarchy that the strength of evidence is increasing from the bottom to peak of this triangle. So there is a highest amount of a strength of evidence with the meta-analysis and the systematic review. The second most is intervention studies, and followed by observational and non-human studies. But at the same time, the major issues, major challenge with those kind of studies are, first and foremost, it is a very time consuming study. Second, when you are in a core research business, when you are identifying something new thing, or when you are generating the an evidence, a very new evidence which is not been there, or which has been required to be strengthened. For that, we are actually utilizing this different methodologies of the research. However, in a programmatic settings, when we require underlying program, we require immediate course correction during the course of a program implementation. So out of all this research, we do have a operational research. We specifically conducting an operational research while simultaneously doing the program intervention. So what is a operational research? By definition, any research that produce the usable knowledge, like evidences, finding, or even a information which is a useful for this, that can improve the program implementation. It has a direct implication on a program. It has a policy implication on a program. So basically, operational research is a research when we are generating the new knowledge for policy improvement and for performance improvement in the running program. So basically, it is a search for a new strategy, new intervention, or giving the new direction to the program. It examines the system. For example, it examines the healthcare delivery system. Even sometimes we do the experiment in the environment specific to the particular program, with identifying if there is any alternate strategy would work or not. So that is an operational research which is very much different from the conventional research. In short, if I would like to summarize the key characteristics of the operational research, first, it should be an objective oriented. We'll come to this. It should be objective oriented. It should be human judgment would be there. Whatever the policy we are implementing, to optimizing that particular policy, for that we are considering the operational research. Sometimes, though we are implementing, but it has not a perfect solution. So this is one of the major characteristics of an operational research. Sometimes in a search of a perfection, the study got extended. So here, even with a certain amount of imperfection, we go ahead with the operational research, and that is a beauty of an operational research. The team, definitely you don't require that much amount of experience to conduct this operational research. Obviously, your approach should be scientific. So with the brief scientific knowledge and the methodology and the brief knowledge of a research, we can kind of conduct operational research. And obviously, the skill of a data analysis, quantitative evaluation, qualitative evaluation would be the provide you the edge for conducting the operational research. So this is a brief background about the operational research. not just an institute or academic is doing the operational research, but multiple organizations are there who are involved in a tuberculosis research. One is ICMR, Indian Council of Medical Research, Department of Biotechnology and its branches. Even the WHO, through their consultant network, conduct the tuberculosis research. Even the operational research conducted by the National Tuberculosis Elimination Program. The later part of this presentation, we will see that the operational research and what are the guidance from the National Tuberculosis Elimination Program. Certain partner organization, when they are actually executing the project, they perform and conduct the operational research. And obviously, last but not the least, one of the major stakeholder for this conducting operational research into the tuberculosis are the medical colleges and academic institute. And if I would like to say very specifically, obviously all the department, but very specifically the Department of Community Medicine, the students, the institute which is providing the public health teaching. So all these are very important stakeholder in conducting the tuberculosis research. These are few of the example in the very beginning of my presentation I would like to give. Like previously you would have heard about, we are supposed to collect two specimen for a follow-up culture of a tuberculosis. We have now moved from the two specimen to single specimen, right? We are comparing. Even previously, if you, some of you may remember that we supposed to collect the sample spot, morning spot sample. So 3 sample supposed to be collected. Later on, we have revised that we need to collect just 2 specimens. So we switch our policy from 3 specimen to the 2 specimen only under the program. So it is a major policy shift. It has a lots of implication, and the evidence for which has been come from the simple research like this. A simple 3-4 page paper has changed entire policy. We have taken the secondary data analysis and conducted it. Similarly, as this mentioned paper comparing the same day sputum, sometimes in a kind of a medical institute where there is a patient are coming over there, and very next day we cannot trace back, we cannot actually trace back this patient coming to the medical colleges for services, and particularly sputum microscopy. The results supposed to come on 3rd or the 4th day. So how can we ensure the spot and the morning sample for a microscopy? Because in a microscopy at least 2 samples are supposed to be necessary, right? So there is another paper we have conducted, and coming from the Chhattisgarh, again a programmatic intervention. Okay, these all the people are the program people. They have actually conducted very small research study within a 3-4 months only and presented the paper that with a certain amount of compromise, we do have a efficacy same as collecting the spot sample, 2 sample, or a spot and the morning sample. So at the very beginning of my presentation, I would just like to mention this couple of examples that what is an operational research. It is very brief and has a direct policy implications. So with this, can anyone guide us as a student, as an academician, for identifying the research priority? There is a long list of a research priority be available on the website of a TBC India. Is a program, official program website. At the same time, it is also available on a ICMR website. It has the entire list of a NTP research priority they have articulated. What it exactly mean by the research priority? Research priority is nothing but the program wanted to have a more amount of evidences around this thematic area, right? So in a parallel to your study, when you are conducting a dissertation, when you are conducting a thesis, when you are preparing a public health report, doing the data collection and analysis, you can kind of select one of the research priority out of it. Now there are next three slides are on the NTEP research priority. In the surveillance, we would like to understand the strengthening of a surveillance and the notification, quality part, and if there is any IT solutions work or not for a completeness of a data. Burden estimation. Last year only, Central TB Division has undertaken a modeling exercise, and that particular modeling exercise has changed the report what we were actually submitting to the WHO, right? And that particular modeling paper was presented in the Indian Journal of Community Medicine, IGCM में ही वो publish हुआ था, that modeling paper. And that modeling paper, an entire exercise of a burden estimation for a tuberculosis state-wise and the state-wise incidence has been presented over there, and it changed the entire data submission to the WHO. Similarly, like for prevalence to notification ratio, any impact of any intervention on a TB burden. So these are the some of the highlighted topic. Transmission dynamics you can conduct. You can conduct the certain amount of a topic on a DRTB. Very recently, we actually conducted and implemented the BPAL regimen, bedaquiline, pretominid, and linezolide containing regimen. It is a fantastic regimen of just 6 months for MDR-TB patient. Cannot be think of an MDR regimen, multi-drug resistant TB treatment regimen, less than 18 months, and now it is just 6 months, almost equivalent time for a drug sensitive TB regimen. Preventive treatment for a contact of a DRTB. So these are the very new area that you can pick it up very quickly. You can kind of do your simultaneous assessment, even acceptance or a patient preference. So such a study has a super value for the program, and it has the potential to change the policy also. In this same line, there are the highlighted topic of a TB preventive treatment, care cascade, artificial intelligence, which is very new now, even the social determinants like gender responsive framework, migrant population, even the tuberculosis in a gig workers, the daily wages. So all those are research priorities conducted. And furthermore, NTEP management, we also would like to understand the program management, patient satisfaction survey, data quality and accuracy, the research in comorbidities like psychosocial conditions, bidirectional screening, impact of a TB preventive treatment in comorbid conditions, even the universal health coverage. What is the role of a PMJ in the tuberculosis implementation? What is the role of a insurance? How we can provide the better services? What could be the model? So these are the very new which is expected from the operational research. ACSM, very niche area. Community engagement and the communication channel. What could be the communication channel and community engagement for NTEP research? As I already mentioned, some of the examples I articulated in very beginning of a presentation, which was very old, like almost 10 years back paper, and now these are the some of the very recent papers, right, which has contributed and implied directly to the policy. integration and decentralized services of a TB HIV. Now, after this paper, the TB HIV coordination and the framework mechanism has been accepted under the program. Entire guideline has been developed. Bidirectional screening has been developed. Evaluation of a TB case finding through the systematic contact investigation. So the contact tracing and the tuberculosis preventive treatment. We took a reference of this paper for devising the policy for the TB preventive treatment. Likewise, community-based active case finding. Now, these days, you may heard a lot of buzz around the active case finding, प्रधानमंत्री टीबी मुक्त भारत अभियान. अगर ये आपने नहीं सुना है और एग्जाम में किसी ने भी पूछ लिया तो डेफिनेटली योर चांसेस टू गेट अ very low mark into the examination, right? So this is a paper, active case finding, has a policy implication. We prepared entire guideline of our active case finding. Tuberculosis Mukt Bharat Abhiyan and 100-day campaign. You might have heard about this. So that is completely based on such a research paper. Very recently, we are actually having the coordination with the private provider and Ayurvedic practitioners. There is a study from the Bilaspur, right? It has a program implication and going to be expanded and going to be prepared a programmatic guideline by the Central TB division with this. Okay, so these are the research priority. Right now, there are few slides on how we can have a research proposal, how we can write a research proposal. अच्छा, चलो हमने operational research समझ लिया, हमने tuberculosis की priority समझ ली. Now we need to write a research proposal. Though it is a specific plan, specific headings under which we should develop a proposal for a tuberculosis, but it is also the general guideline that it should have a title of a study, principal investigator, institute, time period for the study and total amount of a budget, which is to be supplemented with the detailed proposal in a standard IMRAD format, right? Introduction, methodology, and its study objective, and the detail out the methodology, right? For this completeness of a research proposal, we require to submit the institution support letter or institution ethical committee report or the institutional review board letter. Now, why do we write a proposal? Why do you need or to write this particular proposal, entire proposal? So first and foremost, it is a academic requirement, right? So as a part of an academic requirement, you are first writing the entire proposal of your project. But other than this, if somebody is pursuing career in the research or even otherwise also, you may require to write a proposal to obtain a fund, right? To answer the relevant scientific question and priority, to raise and cover the expenses, to ensure the protected time for the research, right? There is somebody says my research study is ongoing and have a detailed study, a cohort study of 5 years. With a different research proposal and the funding availability, we can kind of write the proposal and we can keep ensuring the timing for the proposal for a availability of a fund. We already discussed academic importance. career advancement and the professional goal, very important. And last but not the least, to get into the good research program, learn and advance towards the independent research career. Now you have submitted the research proposal. This is a most common question asked by when you are submitting the proposal, right? So what are the reviewer is looking for in my proposal? I have write fantastic proposal. It is a 15 page. इतना ज्यादा मेहनत करके ये proposal लिखा है हमने. What it actually looking from the lens of a reviewer. What reviewer see in the proposal? First of all, it is aligned with the call for proposal. If there is a call for proposal of a tuberculosis as a topic in the today's discussion, and your subject matter is actually highlighting the NCD, though NCD has implication on a tuberculosis, but in your subject you are actually evaluating or assessing the NCDs, then it is a not an alignment of your proposal which with the call. Second and very important, we'll discuss what is novelty in a next slide. Okay. Third one is a sound science and the methods. It should be brief, at the same time very detailed method supposed to be there. Your team track record and institutional strength is also important, and it is actually giving you the extra edge when the reviewer are reviewing your proposal. And last but not the least, the feasibility, budget and timeline. Multiple proposals are failed to qualify just because of either budget or a timeline. Either it is seen as it cannot be done within the envisaged timeline of a call for proposal, or even sometimes budget is proposed so negligible, or even many of time the budget is proposed so exuberant budget has been proposed in the study, the reviewer obviously identifying a challenge to fund that particular proposal. So although it is aligned, novelty, very high methods, very high level of kind of a methodology, excellent teamwork, but budget is very high proposed, right? So the chances of getting the selection of that proposal is also, so it is an kind of a balance of all this. Now what is novelty? Novelty means it has to be good, innovative idea or a research question. It is not something which is already identified. There is certain amount of a novelty should be there. It has to be scientifically relevant and a significant. It should be high priority. And that's why we have presented the research priority area. If you picked up your proposal from that research priority given by the ICMR, given by in the call for proposal or in the program condition, then your chances of getting acceptance is very high. It should fill the knowledge or an implementation gap. As we discussed, even the proposal for a community engagement, even proposal for ACSM, it is very relevant. And we should have to leverage on preliminary data. So our topic should actually build up on a preliminary data rather than collecting the primary data. We already discussed this feasibility, budget and timeline. So always ask these three questions after preparing your proposal. Is the research proposal feasible? Can I do within that particular timeline? I do have a 3 year of my academic course, either MD or a MPH for 2 years. I do have a 1 year for a research. Can I my research subject could be completed within that particular time frame? Is the budget adequate to deliver the proposed research? Can the research proposed be completed in a academic period? We discuss how the reviewer is looking into your proposal. Now, let's see why application is declined. Although we have discussed already, but still lack of a scientific significance, lack of novelty or originality, lack of a strong scientific rationale, defect in a design or the methodology, unrealistic or ambitious aim, and the feasibility issue. So what is an OR mechanism under the NTP? Just to appraise all of you, and you also would like to appreciate that NTEP support the thesis and operational research. All the medical colleges, those who are interested in the thesis and in the tuberculosis by the PG student or any operational research by the faculty, need to submit an electronic copy of a proposal through the concerned district TB officer or a state TB officer to the state OR chairman, state OR committee in short. Proposal are to be submitted in a prescribed format. That format is already available on NTP website. You must have to have an ethical committee. Then the chances of accepting your proposal will be very high. Sometimes the committee also get back to the principal investigator or the researcher to additionally submit the ethical committee approval. But if you don't have an ethical committee approval, you must have institutional approval for conducting that research study. So in short, institutions should be on board. As a matter of financial support under the NTP, the thesis up to the 30,000 or even any amount of an operational research can be supported under NTEP, providing that the 2 lakh proposal up to 2 lakh can be submitted to state OR, proposal up to 5 lakh should go to the zonal OR research through the state OR, and proposal more than 5 lakh should go to the National Operational Research Committee through the state OR committee. And the principal investigator, letter to your proposal, the principal investigator is invited to the operational research committee meeting to present the proposal sometime. If there is any recommendation or an update be required, the principal investigator will be asked by the committee for a compliance. So that's all from my side in terms of a research priority in tuberculosis. What are the different modalities or the support available under the NTP for doing the research? Even the novice researcher like us can do the research in tuberculosis, and the support are also be available. So I'll stop here and I'll submit back to Ajvi Ben.
If you anyone have question, then you may ask Dr. Solanki sir. કોઈને પ્રશ્ન છે?
I think if there is no question, we can.
Okay, then if there is no question, then I would like to sum up. Thank you, Dr. Sir, for insightful and engaging session on the research priority in tuberculosis. Your expertise has added great value to understanding the TB research and public health. We sincerely thank you all the participants for joining and contributing to the today's webinar. A gentle reminder, these sessions are held on the second and the fourth Thursday of the every month. So please stay connected with us. Have a nice day, and we look forward on the next session. Thank you.